Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrew and I are here to provide everyone an update on the COVID-19 situation across the state for today, June 2nd, 2020. I'm going to provide an update on where we stand with some of the epidemiology and the outbreaks and the numbers, and then turn things over to Commissioner Lambrew before we open it up for questions from our colleagues in the media. And overall, today, with respect to COVID-19, is a sad day for the state of Maine. We're reporting an additional 5 individuals who have passed away with COVID-19 across the state. One was a woman in her 70s from Cumberland County. Another was also a woman in her 70s and also from Cumberland County. The third was a man in his 60s from Penobscot County. The fourth was a man in his 70s from Cumberland County. And the fifth was a woman in her 100s from Cumberland County. I'd like to pause on that last one. Without revealing too much about this woman's age, it's conceivable that this is an individual who began her journey on this earth during the 1920 pandemic and left us during the 2020 pandemic. As with all of these individuals and all of the others who have passed away before them, we offer our deepest condolences to their friends and family during this time. All 94 of these individuals have left behind them close-knit circles of friends, community members, and family members who are grieving during this very difficult time across our country. Overall, Maine CDC is now reporting 2,377 cases of COVID-19 across the state, an increase of 28 cases since yesterday. Of those cases, 2,118 are confirmed and 259 are probable cases. 287 individuals have been hospitalized, and at present, 48 individuals are currently in the hospital. Of those 48, 16 are in intensive care units and 10 are on ventilators. As I sadly mentioned a moment ago, there have been 94 individuals across the state who have passed away and 1,646 who have recovered, an increase of 60 recoveries since yesterday. Of our cases, 572 have been among healthcare workers. And since beginning our activation, the state of Maine CDC has fielded now over 8,100 requests for consultation from healthcare providers and healthcare facilities across the state. I'd like to provide a quick update on some of the outbreaks in which Maine CDC and our colleagues have been most recently and actively involved. At the Portland Family Shelter, we've been working with social services providers to make sure that the social needs of the families and the individuals in those shelters are being met. That involves working with our public health nurses as well as community health workers to provide everything from medical and other healthcare needs to food and other vital services during this challenging time for the individuals at the Portland Family Shelter. Our case investigation is underway, and we'll have additional details as that investigation unfolds. Next, at the Procter and Gamble facility, laboratory samples are starting to be delivered to our state laboratory up here in Augusta for testing. And over the next few days, we'll have results of those initial set of samples. Right now, the confirmed number of individual cases remains at 7, and as more test results come in and as our investigation continues, we'll have further updates on that facility. And finally, a quick update on the Cape Memory Care facility. Overall, the total number of cases affiliated with Cape Memory Care is now at 83, 60 cases among residents and 23 cases among staff members. We're continuing our frequent check-in calls with the team at Cape Memory Care to make sure they have everything they need from a medical and public health perspective, as well as from a psychological and spiritual perspective as well. We're also continuing our work on the public health emergency preparedness front. I went into a lot of those details yesterday, but I did just want to note that even though I haven't mentioned it in a few days, our work with the National Guard on fit testing has been continuing as quickly and as furiously as ever. Thus far, our colleagues at the National Guard have undertaken 58 fit testing exercises at healthcare facilities across the state. Overall, 1,724 healthcare workers have undergone fit testing and are now able to take advantage of the N95 masks that they can wear on the job to help them keep safe from the possibility of COVID-19. As always, the National Guard colleagues have more work ahead of them, and they've got at least 250 more healthcare workers lined up in the coming days who are awaiting undergoing fit testing. And finally, before I turn things over to Commissioner Lambrew, just a quick note on some of the vital everyday medical assets that we track. Overall in Maine, there are 397 total ICU beds, 156 of which are available, 317 total conventional ventilators, 245 of which are available, and there remain available a total of 441 alternative ventilators across the state. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shaw. Good afternoon. Today, Maine Department of Health and Human Services launched a Keep It Maine campaign to promote public health measures that limit the spread of COVID-19. This is a new statewide initiative that emphasizes the importance of practices such as physical distancing, wearing of cloth face coverings, and hand hygiene. The Keep It Maine campaign encourages Maine people to continue their good work that has helped keep COVID-19 in check. Adjusted for population size, as of Monday, Maine ranked 42nd lowest in the nation in terms of positive cases, 40th lowest in terms of deaths, 30th lowest out of 35 in terms of patients ever hospitalized, and 15th out of 41 in terms of the percentage of people who recovered from the disease. This campaign is built around this shared achievement. Maine people and businesses have limited the spread of COVID-19 by keeping to the main values that tie us together. We stay the course and we work together to do what's right for our loved ones, friends, and neighbors. Let's keep it up. Let's keep it Maine. The campaign includes social media and digital ads that will begin this week, followed in mid-June by television ads and a new website with shareable and printable educational materials for Maine people and businesses. We also plan to provide translated campaign materials to ensure its message reaches as broad an audience as possible. We hope to work with partners in healthcare, business, and communities to amplify the campaign's messages, since together we can help prevent the spread of COVID-19. So with that, I'll turn it back over to Dr. Shaw for questions.
Great, thank you, Commissioner. And today's first question from our colleagues in the media goes to Steve Missler from Maine Public.
Thanks. Can you hear me okay?
Yep, go ahead, Steve.
Great. Two questions, Dr. Shaw. I guess I was looking for an update on the tests on the workers at the EOC to see if there's been anything from that, to see what the issue was there. Also, a clarification on a bulletin that was sent out on Sunday related to that too, about cleaning. It said that the facility was being cleaned, but I'm not sure if that's the entire building at 45 Commerce Drive or just MEMA and the EOC. And I have a second question after you answer that, if that's okay.
Sure. So I'll start with the EOC question, Steve. So our investigation continues. We did receive some results back just last night on some of the preliminary testing for other respiratory viruses that we undertook. Each and every one of those for each and every individual was negative. And so now we're looking at other potential options and sort of casting a wider epidemiological net and broadening what we might have, what we were thinking about before. On the good side, almost, I believe, every single individual who experienced some bout of symptoms has now fully recovered, but we're still looking into other potential causes. On the deep cleaning piece, it's kind of in stages. So the deep cleaning that we referenced at that time was deep cleaning for the interior of the MEMA office, specifically the EOC. But there's separately work that's undergoing, being led by our colleagues at DAFS, looking at the HVAC system and making sure that it has been fully deep cleaned and assessed as well.
Okay, thank you for that.
Mm-hmm.
And I guess just as a general question, that you brought up Cape Memory Care today, and as we keep seeing these outbreaks at long-term care facilities, I've been wondering, and this has come up before, and I think you were waiting for some more investigation by the contact tracing team. But do you have a sense of whether or not these outbreaks are partially attributed to workers who might shuttle between different long-term care facilities? Do you have any more information that suggests that that might be one of the problems here? I know that some of these facilities are owned by larger companies and they may move staff around, but it just seems like they continue to happen, and I'm just wondering if that is part of the problem.
So, Steve, I'll start and then ask Commissioner Lambrew if she wants to amplify anything. So nationwide, Steve, we have that has been a topic of discussion and concern among my colleagues across the country about this, the reality that we all know exists, which is staff moving from facility to facility, whether that be a physical or occupational therapist or other type of staff member who sees clients at multiple facilities. So we do and have known that that's a risk. We haven't zeroed in on any exact or precise identification of any of the outbreaks in Maine being traced to a specific individual who may have worked at multiple facilities. That being said, we recognize that it's a risk. It's a reality of the way in which long-term care facilities are set up, but we haven't, in any of the Maine outbreaks, identified a specific person who may have worked at multiple facilities who transmitted or introduced the virus into any specific instance. That doesn't mean we don't recognize fully that it's a risk. Commissioner?
Sure. So there are different types of congregate living settings. I think it's important to recognize that. Nursing facilities are the most advanced. They have staff that are medical staff there 24 hours a day. They do provide some level of medical care within the facility. That's different than assisted living facilities, other types of residential care facilities, which may not have that level of staffing. And what we're trying to do is work our way through those different levels to make sure that, number one, for the nursing facilities, we have emergency rules in place on infection control, including training staff on all shifts to make sure that they understand how to best protect residents, protect themselves. We've been doing trainings with assisted living facilities, other types of residential care facilities. We are looking at what more we could be doing with those different levels, including whether or not we need to be providing more support for infection control, support for training, support for staffing models. So we continue every day to work on what more we could do to prevent the spread of COVID-19. But just note that it's not just nursing facilities. It's a lot of these assisted living facilities and group homes where there may not be a nurse or other clinical staff on site.
Steve, the last thing, go ahead, Steve.
Okay, yeah, I was just going to say, I was just going to follow up real quick on you mentioned that that your investigations have not pinpointed a single person, but have you identified whether it's staffing, which you acknowledge is a risk, and I know the federal government has too. Have you been able to determine whether staffing, whether it's one person or 10 or whatever that are moving through these facilities, whether that is contributing to these outbreaks, I guess is the question.
Yep. So generally speaking, with congregate facility outbreaks, particularly those with medically vulnerable individuals like nursing homes, it generally is staff. And Steve, I want to make sure I answer your question precisely. You're asking if we've zeroed in on one particular staff member or circle of staff members versus a multitude of staff members. Is that the question?
Yeah, generally. I just want to make sure that I'm clear that you guys obviously haven't found one person, but there may have been a collection of people, whether they,
Yeah, it's actually been a bit of both, Steve. In one instance, at one particular outbreak, based on the initial epidemiological chart we'd put together of when symptom onset occurred, suggested that it was a single staff member. In another instance, it suggested that there were other staff members who seemed to be getting ill around the same time. So it's been a mix, and that squares with the experience my colleagues have had in other states. What I'll end on, Steve, is we talked about this yesterday with everyone as well, but it really does show that congregate living facilities, nursing homes, are not islands unto themselves. They are tightly, inextricably linked to the communities in which they're situated. And one of the best ways, I think, to keep and reduce outbreaks in nursing homes and other such facilities is to reduce the overall level of disease in the community. So the two are really not, the two cannot be separated. And the more we can drive down the overall rates of disease in the community, the less likelihood it is that any one or any several staff member may introduce it into the facility. I'm going to turn next over to Charlie at the BDN.
Yes, hi. Thanks, Dr. Shaw. So my questions have to do with the political demonstrations that have been happening actually for a few weeks now in Maine, including some rallies against the state's coronavirus restrictions, the very recent protests about the death of George Floyd, and obviously President Trump may be in the state on Friday, and there could be some more of that activity then. Do you think we could see any new outbreaks or a surge of new cases of the coronavirus because of these events where dozens or even hundreds of people are kind of in close contact and sometimes getting into each other's faces?
So Charlie, again, I'll start and then turn it over to the commissioner. It's impossible for me to speculate. What I can do for sure is, with all sincerity, please ask everyone who's going out there in any circumstance to please wear a face covering, and if possible, maintain as much physical distance between one person and another. Either way, in any event, the more people that are wearing face coverings, whatever the situation, overall, the less likelihood of transmission there is. It's impossible to speculate on what we might see in the future related to any one particular situation. But my advice, my ask, as is always, is for everyone to please do everything they can to take optimum care of their health. Commissioners, anything else on top of that?
I'll add that Governor Mills has been articulate about what's been going on with the protests and the visit this week, so I defer you to her. Her words speak for themselves. I will add that we do have a large gathering limit of 50, partly because we know it's harder to do that kind of physical distancing when you exceed that amount. We've been encouraging all gatherings, including protests, which we encourage to have as peaceful ways to articulate people's views, but to maintain that kind of 50-person limit and cloth face covering, so we are able to both practice our hard-wrought democratic rights as well as public safety.
Mm-hmm. We wish nothing but the best of health for everyone who's out there. I'm going to turn next over to Amy Brown at WERU.
Can I just ask a very quick follow-up? Which
sure,
is
Charlie.
Whether have there been any? So I realize you don't want to speculate about the future, but any cases already that have been traced to any of these protests so far?
So for example, for the protests that have just occurred in the most recent few days, anytime we see a case, it's really a reflection of an event that may have happened 1, 2, or even longer ago. So from the events of the past few days, it may not be for several more days until we see any cases that we can definitively tie to any event like that. So at this point, Charlie, it's just too early to tell. I'm going to turn over to Amy Brown over at WERU.
Thank you, Dr. Shaw. And that's following my line of what the questions that I wanted to ask as well. first, whether or not there was any increase in cases following the reopen rallies, because those have been a few weeks ago now. Just wondering if you're tracking those types of gatherings, if the people who do the contact tracing are noting whether or not people have been to particular types of businesses, just to see if there are any patterns emerging. And then I have a follow-up question as well.
Sure, Amy. So when our contact tracers make contact with anyone who's been found to be a positive case, we ask them anyone and everyone they may have come into close contact with over the preceding 16 days. We haven't determined any exact trends, but that is what outbreak investigation really comes down to. After all the data are put in, if we see a large number of individuals who were at the same barbecue or the same movie or something of that nature, that's when we start formulating theories about whether there might have been an outbreak. Thus far, we haven't detected anything, but these investigations can and do take quite some time as people develop symptoms, as they come in contact with our contact tracers. The process does take some time. Amy, if I could just take one quick second before I turn it over to the Commissioner and back to you. One of the questions that we've received quite a bit in recent days is around the precise nature of contact tracing, what it is and what it's not. Contact tracing at its base is simply a group of folks at the Maine CDC checking in on folks who have tested positive for COVID-19 to see how they're doing. We like to touch base with people, to check in with them, see how they're feeling, and then as part of that, try to get a sense of who they may have interacted with, who themselves might now have the disease. There have been a lot of folks who have asked us if contact tracing is location tracking, or whether we're interested in retracing the movements of any one individual. That's not what contact tracing is. We want to know how folks are feeling, and we also want to know if they came into close contact with folks that we should put on alert so that they can take steps to, say, maybe avoid interacting with an elderly grandparent who might be at greater risk. That really is what contact tracing is at the end of the day. It's not location tracking. It's not prying into personal details. It's us trying to find out other people in any positive person's orbit who might be at risk for COVID-19 so that we can try to prevent them from getting sick before they get exposed rather than after. Commissioner, anything, can I turn it over to you?
Just to add, that's exactly why we're doing this campaign. We think we're going to we want to get people information on why it matters before you're exposed, before you're in a circumstance where you are a contact of a person with COVID-19, to just remind people of the basics about the physical distancing, about hand hygiene, about the importance of cloth face coverings, about why this matters. Because at the end of the day, this is about our neighbors, our friends. It's about keeping this date as special as it is for us and for our children, our parents, our relatives, our neighbors. So we're very excited to be able to be proactive here, because the more we can give people information and tools and understanding of why we're saying wash your hands a lot, I think that will really help get us a long way towards continuing what we've done to date, which again, we are proud of the people of Maine, the business of Maine. We are really near the top of the nation in terms of what we've been able to do to date. But that must continue, especially as the summer months come and there are more people in the state. So we look forward to engaging with the public to just remind them about why we're doing what we do to keep it Maine.
Amy, I think you said you had a follow-up that you wanted to ask.
And I apologize for the background sound here. If there's not a significant increase following a rally where people were in very close proximity and were not wearing masks, and now if we watch what happens with protests across the country where most of the people are wearing masks, but many of them are crowded much closer than 6 feet together, are you watching this and thinking maybe you will revise recommendations if you're not seeing outbreaks following this?
So, Amy, I want to make sure I answer your question straight on. We just don't know whether there will be an uptick in cases related to this event yet, not because the answer is a yes or a no, but rather because it's too soon to tell. What we've seen for sure in other parts of the world that experience COVID-19 outbreaks before the United States is that close congregate settings can generate a high number of cases in a short amount of time. Cruise ships are just but one example, but other outbreaks have been traced to things like subway cars, other very tight congregate settings. Just because we haven't yet detected any outbreaks of that nature is really more of a sign that not enough time has elapsed yet, as opposed to new information about the transmission. There's enough evidence in the literature about transmission when individuals are in close, tight spaces for us to be sufficiently aware that that's a distinct possibility. Time will tell what, if any, cases arise from any of these recent gatherings in the past few weeks. But right now where we are, our goal is to try to keep tabs on that data to look for those trends. I'm going to turn next over to Joe Lawler at the Press Herald. Hey, Joe, over to you. All right, we'll come back to Joe in just a moment. While we turn to Emily Tadlock at WABI.
Kind of touched on this a little bit, but why launch this campaign now? I think it's important for a lot of people to hear, but obviously our eyes and ears are focused on a lot of other issues that are happening right now. And so why is it important that DHHS come out and say, hey, pay attention? Why is it important now that you guys launch this campaign?
I think it's always important to have public education. You know, we've been talking about this from the start. The governor has been a messenger. Dr. Shah has been a messenger. We decided weeks ago that it was time for us to begin to bring this to people in different settings, you know, through TV, through social media, through signage, because we do know that as part of any public health effort, communication is critical. The hard part about public health is we're asking individuals to make a change in how they interact with people, how they engage with the public as a means to protect their neighbors, their friends, their families. So we thought it was a very good idea to really tap into the kind of images and words that will be effective at reminding people why we're doing what we're doing.
Thanks, Emily. I'm going to try Joe Lawler again. Joe, your line's open. Okay, we'll come back to Joe in a moment while we turn to Mr. Don Kerrigan.
Yes, good morning, good afternoon, Dr. Shah. Can you hear me?
Yes, go ahead, Don.
Okay, thank you very much. I have a follow-up question to what the commissioner just said, which is, I understand the point that you and the governor and Dr. Shah have been talking about these things for the past 2.5 months, but it would seem that a social media public service big campaign about these habits would have been put forward 2 months ago. And was it felt not necessary then, but is now? And what is, if so, what has changed? And Dr. Shah, I do have a separate question for you, please.
Sure. I don't think anything has changed. And I will just say better late than never. And I wish we were at the end of the pandemic of COVID-19. I'm not sure we are. I think there's more time before we're going to get the kind of treatments and vaccines that really put us at the end of COVID-19. But we are happy to be able to do this now. We think is a good use of the federal dollars that we've gotten to combat COVID-19. And we look for partners in doing this. We know that there have been different states that have done this. There's some US CDC ads that are out there. Some of our main partners have had very effective messages as a part of their advertising for their own companies. And we thought it would be a good idea for us to really put the muscle behind this to really make sure that people in Maine understand why it is so important to keep up the good work that they've been doing to keep in Maine.
Commissioner, so is the campaign all ready to go, and will we see it starting today or tomorrow, or is it being developed?
It is developed. We will see it beginning this week with social media and digital ads. We expect television ads and a new website with shareable and printable educational materials in mid-June.
Okay. And Dr. Shah, I was sent just a very short time ago a written proposal that sounds like it has come from the state, although I'm not clear about to try to avoid the need for the quarantine, including a plan that would allow people to get tested, people out of state, I guess, to be tested and have written proof that they tested negative, and then therefore avoid the need for the 14-day quarantine. Is the state actively proposing that sort of a plan, or is that coming from outsiders?
So this is something DHHS and DECD have been working in close contact with. I'll turn it over to Commissioner Lambrew for that.
Sure. So we have been in our plan for restarting the Maine economy, trying to work both grounded in science and data. We work with Maine CDC every day to monitor epidemiological data as we have throughout the reopening process, including case trends and hospitalization rates and reports of symptoms, as well as the healthcare readiness and capacity. We are now in stage 2 officially in the month of June of our reopening and have been looking towards stage 3. DECD, our Department of Economic and Community Development, thought it wise to begin to engage with stakeholders as we move to this important stage 3, where we're dealing with lodging in Maine, overnight campgrounds, seasonal visitors, which, as everybody knows, swells the population of Maine to many times its current population, and wanted to begin to engage with different parts of the state to see what ideas are out there. We think the framework that we're considering about thinking about an alternative to quarantine, using symptom checks and other science to get at COVID-19, and really engaging communities make some sense, but we want input on how to do that. So we continue to engage this week as we develop proposals for the governor's review.
Is there a timeline that to come up with for an actual plan? I mean, you plan to have that by next week?
I think it's safe to say that the state of Maine works day and night to try to figure out how do we both protect the public health and consider a safe reopening of our economy, recognizing how important our businesses are to our state. We know that people want to work, they want to engage, but they want to do so safely. So we're working as swiftly but as smartly as we can.
Thanks, Don. We're going to turn over to Megan over at WMTW.
Thank you for taking my question, Dr. Shah. It really surrounds case counts and upticks or not, depending on the day, as we've seen more and increased testing. Do you have any kind of evaluation of, since we've really increased testing and been able to offer it and eliminate the tiered system, of how we've seen different case counts during the day? For example, it was 28, I guess today, 24 yesterday, which seems relatively low. We have had a couple of days where it's been high, but are you surprised that it has been lower, or are you thinking that it's higher than you expected? Does that make sense? Yeah.
It does, Megan. So 2 observations. The first is that nationally, not just in Maine, but across the country, there's been a pretty pronounced day of week effect that's noted across the country with the rate of new cases. And a lot of that reflects the way in which people start feeling bad, and then when they call their doctor, and then when they can get in for a swab. And there's a fair number of analyses that have been done about day of week effects, and Maine's data tracks those pretty well. Now, in terms of what we've seen overall, since not only we more than tripled our lab capacity, but in concert with that, removed all the testing prioritization tiers. What we've seen is a few things. The first is that we have detected cases in congregate settings. And that has been one reason why we saw upticks a week or 2 ago, notably with Cape Memory Care, where there were a high number of cases that were detected, directly as a function of universal testing. The other thing we've seen is that our positivity rate has reflected that. We've seen that as we've done more testing, we've A, had a lower positivity rate, but B, detected a high number of asymptomatic individuals as well. Those asymptomatic individuals are really, truly critical toward trying to reduce more cases. We talked about this a little bit yesterday. One reason more widespread testing is critical is not so much because you want to identify people who aren't feeling well. That's really important. But one of the essences of greater testing is to find people who didn't have any symptoms at all so that they can be asked to be in isolation and reduce transmission. And what we've seen in instances where we have undertaken a high amount of universal testing is that we've detected a fair number of folks who are asymptomatic or pre-symptomatic. We can get you some of the numbers on that to give you a better flavor. But for example, even at Cape Memory Care, a high number of the individuals who were diagnosed in the first round hadn't yet developed symptoms. And even to this day, among the residents at Cape Memory Care, among those who have been positive, only about 56% have been symptomatic. They may later go on to develop symptoms, but they weren't symptomatic at the time of testing, which tells us that if we can get those folks into safe, supportive isolation, their likelihood of transmitting it to others is that much lower. We've seen that across other venues as well, and that really does speak to the value of that widespread testing. I am going to turn next to Patrick Whittle over at the AP.
Thank you very much. I'm curious if we're any closer on having an idea of when restaurants and other restricted businesses in the three counties are going to be able to reopen, and also with school coming to an end for this year, that means we're pretty close to the beginning of school for next year. And I know there's still a lot of moving parts about what school is going to look like next year, but I would love to know if there's anything concrete that you can talk about precautions that are definitely going to be happening between now and then.
Sure, go ahead.
Look, as I said previously, throughout this process, Maine CDC has been monitoring these epidemiology data, the case trends, hospitalizations, this positivity rate, which I will just note. We are trying to post more recently. There's a new update this morning that shows that of all the more accurate PCR tests that have come back, 5.03% are positive, which is the same as it was last week and down from previous weeks. So we do monitor those trends, but we also are looking at the circumstances that are on the ground. What's going on in these different areas? Is there data that suggests that we should go slower? And that will be a day in, day out calculation. We will announce our changes as we have them. We have no new announcements today. And that goes the same towards schools. I know that the Department of Education has been working aggressively with stakeholders. We appreciate the lead time that it takes for schools to think these things through. But as I just said, we are continuing to look at our trend data to try to figure out what we know, what might be safe, and where we go from here. And we have no announcements on that today.
Thanks, Patrick. We're going to see if Joe Lawler is on the line and give Joe a shot. All right. Well, Joe, if you're on and your audio is having difficulty, please reach out to Robert Long and we'll get you an answer to whatever question you may have. Commissioner, that was our last question. Anything on your end?
Sure. I think I'd like to say, going back to why we're launching this public education campaign called Keep It Safe, is because we want to make sure people know that public health measures, such as those that have gotten us this far, remain especially important as we begin this reopening of Maine. As more people are engaging, as we are getting outside, as we're going out to restaurants outdoors throughout the state of Maine, it remains just as important that people follow those good practices, keep their distance, keep their cloth face coverings on, wash their hands. Those are the keys to keeping Maine safe, and we thank everybody for following it to date and to continuing to be vigilant as we enter these new phases.
Great. Thanks, Commissioner. And to everyone joining and tuning in today, thank you so much for your time this afternoon. We appreciate you joining in and listening to the latest on the COVID-19 situation across the state. We know that these are challenging and fast-moving times, and I think I speak for the Commissioner when I say that we wish everyone out there who's watching today nothing but the best of health. So thank you so much for tuning in today. We'll look forward to chatting soon. Thank you.